Good morning, everyone, and welcome to Live with the County of Santa Clara. My name is David Campos. I'm a co-lead public information officer. I'm here with my co-lead, Betty Young. As you could see, we were wearing our face coverings before we started the recording, the taping, but we took off our coverings so that we could allow the ASL interpreter to properly interpret the program this morning. So thank you very much for being with us. Hope everyone is safe. And today we're here to talk about what it means to be in the red tier risk level. As you know, a few weeks back, the state of California moved from a system that placed people on a watch list, counties on a watch list, and now has different levels of risks, colors of dictating. So I'm here with Betty to talk about what it means to be in the red tier. A lot of people have some confusion about that, and we have heard in comments on social media that because we have been on the red risk tier for about 3 weeks, that means that we are automatically moved into the next level. And so Betty, can you explain a little bit about what it means to be in this level and how that works?
Sure. So, as we all know, or most of us know, we are currently in the red tier, which is, the second strictest tier on the state's measure structure framework there. And it's really determined by 2 metrics. And I'm going to say it's really determined by 3 metrics, right? So the first metric is going to be our daily case rate per 100,000, and the second metric is our our positivity rate. So at this time, as of today, our daily case rate per 100,000 is 5.9, which puts us into the red tier, substantial tier. Our adjusted daily case rate, though, is 4.7. That's the rate we're being evaluated on. And the reason why that number is lower than our actual case rate is because of the massive testing, all the testing that our county residents have gone through and undertaken on a regular basis. The second major metric is the positivity rate. The positivity rate in Santa Clara County right now is 2.4. So for all those who are paying attention to the tiered system, our 2.4 positivity rate puts us into the orange zone. But because our adjusted daily case rate still falls into the red tier, we're still in the red tier. When one out of the 2 metrics, when 2 metrics fall into 2 different tiers, it's going to be the more stricter tier that we're going to be assigned to, and that's where we currently are right now. In the red tier, more businesses are allowed to resume. Indoor personal care services have been allowed to resume, but there's still some restrictions here at the county that is different from the state tier.
So before we get into that, just so that people understand, so we have a situation where the 2 main metrics, the number of cases per 100,000 and then the positivity rate, they're such that each one puts us in a different red risk level, but the strictest one applies. So that's why we are in red. Now, we also remind people that the purple tier, which is the strictest, is what we moved out of into the red. And that happened because of the progress that has been made and the sacrifices that every resident has made. So let's talk about what it means to be in the red risk level, in the red tier. What does that mean in terms of what businesses are allowed?
So, the biggest, like I mentioned, the biggest change is probably of the resumption of indoor personal care services, massages, hair services, nail salons are now allowed to resume indoor operations. While we were in the purple tier, you all may remember that those services were still being provided outside. Now, we do differ from the state's requirements in a number of ways. At this time, even though we're in the red tier, the county does not allow for indoor dining, does not allow for indoor movie theaters to operate, and we do not allow for indoor gatherings. I just want to remind everybody that the state's guidelines serve as a floor, not the ceiling, and that's by design. There's no such thing as a one-size-fits-all set of guidance for the whole state of California. So while the state's guidance serves as the floor, it allows each county to move through various levels of restrictions, right? Well, I mean, not move, but each county is able to determine its own set of restrictions We can never be less strict than the state, but we can be more strict than the state. And that's really based on the number one priority to prevent the loss of lives. At the end of the day, that's the number one priority guiding everything. And so to do that, sometimes we need to have more restrictions in the state because of the demographics, because of the population size, because of the amount of industry and commerce that takes place here in the county. There are just certain risks that we're not ready to take yet.
Now, before we continue, I do want to acknowledge that we started a little late today and we had some technical difficulties. We're always trying to improve our systems. Yeah. So our apologies to people for starting a few minutes late, and thank you for hanging in there with us. Yeah. So let's talk about sort of how this process works. So we are in the red tier. Mm-hmm. The next level, the less strict level is orange. So how does Santa Clara County go from red to orange? How does that work, Betty?
Well, the main thing that we can do is that we can continue to test. Right now, our positivity rate is squarely in the orange tier. It's 2.4. You need 2 to 4.9 to be in the orange tier. So we're there. But because our case rate is still in the red tier, that's why we're still in the more strict tier. The more testing we do will give us, will be incentivized with a lower daily case rate with the more testing that we do. So just based on the way the state calculates the rates, the more testing, the better. And so, we got to continue testing. We're going to keep on pushing it. We've seen a lot of social media comments, saying, we get it, like we've heard this before. And we're going to keep on pushing it until we just get to a point where, we could just have some sense of normalcy again. And that's what we're looking forward to, a safe future for all of us. And, again, we have to remind everybody, continue to wear your face covering, practice social distancing, and wash your hands. Those are the main things.
So let's talk about this specific. Because as you noted, our case rate is 5.9 per 100,000, but then when it's adjusted for the level of testing that we're doing, it's 4.7.
Yes.
Right? As I understand it, to be able to move to orange, you have to be lower than 4, right?
You have to be 3.9 or below.
Yes.
So 1 to 3.9 is going to put us into the orange zone.
So even with the level of testing that we're doing, 4.7, we're still not in the orange level.
No,
right?
Not yet.
Now, can we talk a little bit about the rules, right? So as I understand it, once you move to a new level, you have to be in that level for at least 3 weeks, mm-hmm. right? And then you have to be in the numbers that allow you to be in the next level for at least 2 consecutive weeks, mm-hmm. right? So you're really looking at a 5-week period for you to be able to finally move into a next phase, right?
Yeah, so we spent a little over 3 weeks, I think almost a month in the red tier now. We just got to hit that orange tier number for at least 2 weeks before we could squarely be there.
So let's talk about San Francisco, because a lot of people are saying, so San Francisco moved to the next level. Mm-hmm. They're now orange, right?
Yeah, I heard the news this morning, as I'm sure everyone else has. Oh, and the news this week, yeah.
So let's look at San Francisco's numbers, right? Mm-hmm. Because we are doing well in the positivity rate, but it's the case numbers that are the issue here. So San Francisco's unadjusted case number is 5.3. Mm-hmm. But their adjusted number is 3.2, which is under 3.9, so that allowed them. So why is San Francisco able to be orange? How did that adjustment happen?
Well, one reason, testing. San Francisco has conducted more tests than we have. On a daily rate, they test way more people than our county has. Our county does have way more people, a larger population, but kudos to San Francisco and to the residents of San Francisco for being so committed and making testing part of their weekly routine, their regular routine, and that's really what has put them into the orange tier. And I feel very confident, David, that our residents will be able to rise to the same challenge.
Well, one thing that I would note is that San Francisco began this with an infrastructure. Mm-hmm. They have an ongoing relationship with the UC system, so they were able to really, implement high-scale, broad testing from the very beginning. we had to develop that. And we actually are testing more than most counties. San Francisco is testing more than any other county. So I want to talk about that because the need to increase testing is why we issued the testing order, right? And so, as we pointed out before, the county is doing its part. We are testing more than our fair share. You know, a lot of the testing that's happening in the County of Santa Clara is being done by the county system. So if these private health hospitals actually tested at the level that we wanted them to test, we probably would be in the orange today.
I think that's a fair conclusion to make. And just as a reminder for folks, the testing order that David is referencing is a recent health order that requires all major healthcare facilities in Santa Clara County to provide you with an easy, accessible, free COVID-19 test if you fall into one of 3 categories. Category 1, if you are an essential frontline worker. If you work at a job that requires you to interact with members of the public on a regular basis, you should, even if you have no symptoms, you should get a COVID-19 test at least once a month. If you do more than that, no one's going to be mad at you. The second category is that if you have had contact or engagement with someone who is a known positive. And then the third category is if you're experiencing any type of COVID-like symptoms, which during this season can be easily confused with flu-like symptoms or other type of COVID symptoms. But those are the 3 categories, and if you fall into any one of those categories, contact your healthcare provider. They should be able to provide, they are required to provide you with an easy, accessible, timely, free COVID-19 test.
So again, if we had a situation where these healthcare providers were testing at a higher level, chances are that we would be able to have the numbers to move into the next phase.
I think so.
So we're at 4.7. Again, what is it that we need to be at to be able to move?
3.9.
3.9. And for how long do we have to be in that range to be able to move to the next tier?
For at least 2 weeks.
Okay, for at least 2 weeks.
And I know we can do it.
Okay, great. Yeah. Thank you, Betty. I think we wanted to take this opportunity to really, share that information with folks, clarify any questions that people have. And just so you know, we do read your comments and we try to be as responsive as we can to every comment. So thank you for tuning in. Please stay safe out there. And, it's because of the sacrifices that people in the County of Santa Clara have made that we are where we are, and if we continue to do that, we'll be able to move to the next phase.
Thank you, David.
Thank you very much.
A couple reminders is that, at this time in the county, services directly to the face is still not allowed. I know that really affects our estheticians out there. We hear you, we see you, we read all of our comments. Estheticians in the esthetician industry is in every single meeting that's happening every single day. It really is requiring us to monitor, it really requires that we monitor the current status of COVID and the spread of COVID throughout our community. That will determine what the future looks like in terms of services to the face. But we are anxiously awaiting for the day that we can provide you some more clarity and direction. I also want to take this time, like as David mentioned, that we do read all the comments, and I want to just I was going through some of the comments right before we started, and I just want to kind of give out some shout outs right here. So top fan Simon. So Simon, we know you well here, and we really appreciate all the feedback and all, constantly monitoring and staying with us. You did say that you did have a really good recommendation in terms of adding a graph to our site that tracks the state's tiered system metrics and where we land on that. I think that's a great idea. Our whole PIO team, actually, that was one of the points of discussion today, and we'll be sharing that with our epidemiologists and with our situation analysis team to see if that's something that we can get done. Randy, you asked if Dr. Cody's going to speak. As you can see, you asked for doctors, instead you got lawyers. But we work closely with the doctors. We have a large team of epidemiologists supporting the whole EOC operation and supporting Dr. Cody. But I hear you. I think, we would love to have more doctors on. I think that'll be really helpful for the conversation. So we're going to take those feedback into account. You did also ask about transition from red to orange for the city of San Francisco, and David was able to touch on that. Let's see. There was also Lisa, you asked about what are the conditions by which the county returns to the purple tier. The 2 metrics we discussed today, at any time, if one of the 2 metrics lands into the purple tier range, we are back in the purple tier. So folks, please continue to keep vigilant. Now is not the time to ease up. We're gaining momentum, and let's keep it going. Lyndon, you asked about playgrounds. Playgrounds are actually open, but just like anything else that's currently open during this time, there are certain modification and requirements. I recommend that you check out our county coronavirus website, www.secgov.org/coronavirus, for more specifics as to what you can expect or what is expected of everybody at a playground. And then, of course, our estheticians. Leanne, I hear you. We see you. Like I said, esthetician and skincare services is something that's in every single topic, every meeting that we've been having, and we hope to see a day where we're able to have more details and more direction in that area. Thank you, everyone, for joining us. Thank you, David, for this morning.
Thank you, everyone. Be safe out there. Have a good day.